is there a way you can help explain even more the details of residential treatment? So I know residential treatment is something you just mentioned about, but what does the day-to-day look like for residential?
Sure. So for us, there's a wake-up call, there's breakfast, there's kind of a check-in group where we assess the mood of everyone, and on a daily basis, we are assessing any suicidal or homicidal thoughts. Now, we do get that people with OCD also have obsessive thoughts about suicide or homicide, so it's not like someone's necessarily with that going to be on a watch or something like that, but we're daily assessing those things just to check the mood and the pulse of the person as they're going. Then we go into 2.5 hours of exposure therapy and CBT education in the morning. We take an hour break for lunch. We do another group. It's either like a chaplain meets with everyone, but that's not a religious group. It's more like dealing with guilt or loss or those types of things. So it's just taking a look at some general themes that kind of underlie some stuff that we see with OCD. And then, or it could be expressive therapy too. And boy, we've got some great artists in there, and they've drawn out different things about their OCD and found it just a great way to express themselves, different than just talking about it sometimes, which has been really nice. Yeah. And then we go into another 2.5 hours in the afternoon of treating OCD with exposure therapy and exposure response prevention and cognitive behavioral therapy, education. Sometimes we even go do outings. So we've taken people out to Woodfield Mall, and we've done some exposures out there with various people depending on what it was they were afraid of. So we had one time we had a group of people with contamination, so they were touching the escalators and the buttons in the elevators, while another group who had intrusive thoughts about harming kids, we walked them around like various kids stores and stuff like that.
So it's a unique experience based on the person who goes there.
Absolutely, yeah, it is. It's absolutely, their treatment plan is driven by what kind of OCD they have.
And so how many days is it exactly?
We will see anywhere from about 25 to 45 days is pretty typical that we'll have people there. We're always shooting for that, more if we can, but a lot of times that's one thing that's a little unique about us is we do take insurance. So sometimes that decision is also driven by the insurance companies who say, you know, that we think that they're ready to step down to PHP. So we may have a little shorter length of stay than some people, but that's because we don't have the same kind of self-pay that some other places do. But it is helpful for people who do have insurance that we will usually be able to take that.
So in that unique model, do you have outcomes associated with the the journey that someone goes through from the time they start AMITA's residential treatment to the time they end?
Yeah, we do, and some of that is just coming out now. We're newer, so we're getting there, and we're actually right now implementing a brand new system, so I'm excited that it's going to be even better. The paper system, of course, isn't always the greatest when things get shuffled and stuff, but we've got some of that data, and I'll have some of that for us for next time. But I'm excited that we're going to this whole new computer-based system that we're going to be able to do with instantaneous reports and everything like that.
That's so special. The values too, so for people that aren't familiar with exposure response prevention, it's one of the most effective forms of treatment, it's the most effective form of treatment for OCD, but it's known as one of the most effective treatments overall in a population.
I use it for all anxiety disorders. I don't care if you have OCD or panic or whatever. We're doing exposure and response prevention treatment for it.
So the outcomes though for OCD are really strong, and that's the exciting part, right? So now you have access to people who can walk you through ERP treatment for over 25 days straight. And that's if you're looking to get better. What better opportunity than that?
Just in one, like the Y box, which is the Yale Brown Obsessive Compulsive Scale. Our average I'd say would be around a 29, 30 when someone comes in, and people are leaving at like 14, 15, 16.
Wow, that's fantastic.
The drops are huge.
Significant reduction.
Yeah, absolutely significant reduction. So it's been really great.
Yeah, and how would you know if? I know we talked about the different severity levels, but like if somebody is in a position where they think they can benefit today, what would that process look like to get started with AMITA's residential?
If it's with our residential, you call 847-981-5900 and say, I want to talk to intake. And we can usually turn it around within a day or two of somebody coming in if they need to. We've got openings, so we can do that.
That's great. That's fantastic. And so, we're really excited to work with Dr. McGrath and his team at AMITA, and kind of like I said before, being that kind of hub that sits underneath their stepped pyramid, right, where they have the IOP, PHP, and residential. And the reason why is because again, it's it's all about quality of care, right? And so getting people to the most effective forms of treatment possible for their condition and getting them to the right form, right? And so, I think Dr. McGrath and his team really focus in on that, and that's something that we really look at closely because we're a values-driven organization.
Well, it's what your team does too.
Right.
I would echo that 100%. That the dedication of your team to help people with OCD has been amazing. So that's been great.
Oh, thank you. We're working hard, and our goal is to completely, revolutionize the way people can access help if they have this condition. And today, it's just the help is limited. There's a lot of incredible providers, but we need more who can understand how to treat OCD. We need better reimbursement for providers who are treating it. And we also need more improvements within quality of life for providers as well as for patients going through the treatment. So I think the value of technology is you can actually check the box and improve every one of those things I just mentioned, right? Where you can create more efficient treatment processes. You can work from home. People can get treatment no matter where they live, right? You can show the size of this issue, and you can show how it connects to other conditions, and as a result, really show the need for better reimbursement, right? And so that's where our focus too is. We want to be the in-between that can help amazing teams such as Dr. McGrath's at AMITA really deliver on their mission. So
great.
Yeah.
Well, we'll probably have some questions,
Sure.
and so I think Kaylee was going to bring those in. So when she does, we'll be able to get those.
Great.
She's sitting out there. We're ready, Kaylee. Give us a moment, everyone. Your best Vanna White. Thank you very much. Yes.
All right. What is the number one characteristic to look for in an OCD therapist?
That's a great question. The number one characteristic to look for in an OCD therapist would be somebody who understands what exposure and response therapy is and is willing to do it with you. That, to me, would be the most important thing. If you get a therapist who says, oh, well, we're going to talk a lot about your OCD, and we're going to hope that it goes away, or whatever. It just, those kinds of things. We're going to talk a lot about your family of origin, all that kind of stuff. That's not what you need. I've always said to patients, here's the deal. Let's do exposure and response prevention now, and if you want to figure out why you have OCD or where it came from, I'm happy to do that after we do the exposure therapy. Right. No one has yet taken me up on the offer. Because once they've done the ERP and they start living their life, they're really happy.
Right,
so
right.
That to me is going to be the biggest thing. And I want to say this to anybody out there who has OCD, who's thinking about seeing a therapist. Do not at all feel bad about interviewing that therapist and challenging them. Because if a therapist can't tell you about the work they do and the rationale behind why they do it, they're not worth seeing.
Right.
And if they are offended that you're asking them about your credentials and your training in OCD and everything, get up and walk away. Yep. Don't waste your time.
Definitely.
Mm-hmm.
And if someone just asks, how can I find a therapist in my area?
Well, you're building a list of therapists, right, through the NOCD app for sure. So that's one great way. And we also use the International OCD Foundation website. They've got a whole list of therapists as well too. So that would be another option as well.
Definitely. There's a website, just to echo Dr. McGrath, there's a website that we've built that it lists therapists based on location that also have specialty training in treating OCD. And so we're actively monitoring that list to make sure that the clinicians on there are exposure response prevention.
And that's the nice thing about your list, is that you can really vet people and say, this person knows what they're doing.
Right,
Yeah.
exactly.
Mm-hmm.
Exactly.
Okay.
Great.
All right, well, thank you for those questions. We appreciate those. And thank you everybody for listening today. We really do appreciate your time. Stephen?
Yeah.
Good to work with you again.
Dr. McGrath, likewise. All right, look forward to the next one. Thank you very much.
Bye, everybody.